Hi friends, welcome back to my channel Mookambika Nursing. Friends, here we are discussing MNS exam previous year questions and answers. Also we are discussing ESIC previous year questions and answers. Surely these questions will helpful for your exam preparation. You can get some idea regarding the topic which the questions already came. Okay. Let's see the questions. The shortest diameter in fetal head is options. Option A biparietal diameter, option B bitemporal diameter, option C suboccipitofrontal diameter and option D occipitofrontal diameter. The correct answer is option B bitemporal diameter, shortest diameter in fetal head. First option, biparietal diameter, it is 9.5 centimeter. Bitemporal diameter is 8 centimeter, that is the shortest diameter. And occipitofrontal, last option, option D, it is 11.5 centimeter. The second question, which type of epithelial tissue is composed of several layers of cells? Options, option A, simple epithelial cells, option B, squamous epithelial cells, option C, stratified epithelial cells and option D, columnar epithelial cells. Correct answer is option C, it is stratified epithelium. The type of epithelial tissue is composed of several layers or multiple layers. Epithelium is stratified epithelium. It is also known as laminated epithelium. And the next question, the contractile protein in skeletal muscle is options. Option A troponin, option B tropomyosin, option C actin, option D adenosine. Contractile protein in skeletal muscle is actin. Option C is the correct answer. The contractile protein in skeletal muscles are actin and myosin. Here actin is there. So that is the correct answer. Move on to the next question. Willis-Ekbom syndrome is also known as options. Option A, Klein-Levin syndrome. Option B, Erasmus-Lex syndrome. Option C, Gangster's syndrome. Option D, none of this. Willis-Ekbom syndrome is also known as option B, Erasmus-Lex syndrome. Ekbom syndrome means it's a chronic neurosensory disorder characterized by strong urge to move. The patient wants to move his legs, but the patient feel an uncomfortable paresthesia. Paresthesia means numbness in his legs. That is known as Ekbom syndrome. And the next question, Salter scale is employed to measure option A mid-arm circumference, option B birth length, option C skin fold thickness and option D birth weight. Salter scale is used to measure birth weight. Option D is the correct answer. And the next question, which among the following is a cardioprotective fatty acid? Options, option A oleic acid, option B palmitic acid, option C stearic acid, option D omega-3 fatty acid. Correct answer, option D omega-3 fatty acid is a cardioprotective fatty acid. And the next question, the maximum effect of a drug is defined by options. Option A therapeutic index, option B potency, option C efficacy, option D adversity. And the correct answer is option C efficacy. The maximum effect of a drug is defined by efficacy. On to the next question. Drugs used for a rare disease is known as options. Option A orphan drugs, option B rare drugs, option C emergency drugs and option D over-counter drugs. Correct answer is option A orphan drugs. Drugs used for a rare disease is known as orphan drugs. And the next question, when assessing blood pressure, the sound that heard through a stethoscope placed over the artery is termed as options. Option A vesicular sounds, option B Korsakoff sounds, option C bronchial sounds, option D murmurs. And the correct answer is option B, Korsakoff sound. While we are assessing blood pressure, the sound heard through a stethoscope over the artery is known as Korsakoff sound. Option B is the correct answer. Move on to the next question. The main abductor muscles of the upper limb is options. Option A, latissimus dorsi. Option B, deltoid. Option C, pectoralis major. Option D, pectoralis minor. And the correct answer is option B, deltoid muscle. The main abductor muscles of the upper limb. Abductor muscles means the muscles which cause movement of the body away from the neighboring structure. Here, abductor muscles of the upper limb is deltoid.